Hey there, health enthusiasts and curious minds. Welcome to today's roundup of the most fascinating health discoveries making headlines across the globe. Let's start with the question. Does exercise truly help us live longer? A new twin study suggests it just might. By examining genetically identical siblings, some active, others less so, researchers found that those who kept moving enjoyed longer lifespans and fewer chronic illnesses. The beauty of twins is that many genetic factors are already controlled, meaning differences in physical activity stood out. Whether it's brisk walking or a home workout, the study hints that consistent exercise can add extra years of health. These findings reinforce what many of us suspect. Activity isn't just about burning calories, it's also about fueling a better future. So if you needed that nudge to tie your sneakers, here it is. Your body, and maybe even your genes, will thank you. Long COVID has also been making waves, with new evidence showing that some symptoms may last up to 2 years. Early on, many assumed the virus was a short-term ordeal. But for some, the effects linger far beyond recovery. People report persistent fatigue, mental fogginess, and even respiratory trouble long after they've tested negative. What's striking is that severity doesn't always match how hard they were hit initially. Some with mild cases experience ongoing health issues, while others who were seriously ill bounce back more quickly. Medical experts are working hard to unravel the mysteries behind these prolonged symptoms to develop effective support and treatments. This has sparked fresh dialogue about patient care, with many calling for a broader understanding of recovery timelines. If anything, it's a reminder that healing from COVID-19 can be a marathon, not just a sprint. COVID-19 research has also uncovered clues that might help people with chronic lung conditions. Scientists discovered how the virus causes certain cellular responses, which could translate to new therapies for ailments like COPD or lasting breathing issues. By focusing on how COVID-19 inflames lung tissue, they're finding pathways that may be relevant even when the virus isn't present. If doctors can reduce inflammation or prevent scar formation, they might significantly improve quality of life for millions dealing with long-term respiratory troubles. Though more studies are needed, this offers a spark of hope for those who constantly struggle to breathe. It's another example of how intense research into one disease can lead to breakthroughs in others, proving that every new insight can open doors we never knew were there. In South America, researchers recently identified a coronavirus similar to MERS lurking in bat populations. This discovery may raise eyebrows, but it's not an immediate cause for alarm. Scientists constantly monitor animal viruses to spot potential threats before they reach humans. While most of these viruses never make the leap, it's crucial to track them closely. MERS, for example, circulated in camels and occasionally crossed over, causing severe illness in people. By examining the genetics of this newly found virus, experts can see if it has any red flags that might enable it to jump species. The ultimate goal is prevention. If scientists know what's out there, they can develop vaccines or other measures faster. It's another reminder of how connected our health is to wildlife and ecosystems, and why being proactive benefits everyone. Another surprising breakthrough involves a world-first clinical trial for an oral snakebite treatment. In many rural regions, venomous snakebites pose a major health risk, and traditional antivenom often requires refrigeration and trained staff to administer. This new pill could sidestep those hurdles, allowing people to treat bites quickly, wherever they happen. Early results show promise in neutralizing venom more effectively, reducing the chance of lifelong damage or death. This is a huge deal, considering how many people each year face severe complications from snakebites due to late or inadequate care. If the treatment clears more extensive trials, it could drastically cut down on the global toll of snakebite injuries. Sometimes the simplest ideas, like a pill instead of an injection, can have the biggest impact, especially in places where medical resources aren't always close at hand. Speaking of life-saving interventions, an initiative in several low- and middle-income countries is boosting how fast brain infections get diagnosed and treated. These infections can turn lethal if they go unnoticed. Symptoms sometimes look like more common illnesses. Now, healthcare workers are learning to spot warning signs early, like unusual headaches, fever patterns, or neurological issues. Coupled with better access to diagnostic tools, this is saving precious time and lives. Such programs may seem small-scale, but they're a huge leap forward in places where medical resources are stretched thin. By focusing on training and equipment, these interventions empower local clinicians to handle emergencies on the spot. The results have been promising. Fewer missed diagnoses, more timely care, and improved survival rates. It's a testament to how targeted, practical measures can deliver immediate benefits where they're needed most. Another area seeing major progress is brainwave monitoring, thanks to a new broadband approach. Instead of zooming in on just one frequency band, researchers capture a wide swath of brain activity to reveal richer patterns. Our brain is like an orchestra. Different sections operate simultaneously, and limiting your focus means missing half the music. This broader lens could lead to better treatments for conditions like epilepsy, dementia, or even mental health issues by spotting early warning signs or subtle shifts in brain function. It's a step up from older methods that only tuned into certain channels, leaving gaps in our understanding. While it's still in early stages, this technology could pave the way for more personalized therapies, giving doctors the detailed information they need to tailor interventions more accurately. It's a game-changer in the quest to better decode our brains. In cancer news, there's hope for head and neck cancer patients through combination immunotherapy before surgery. Traditionally, These cancers rely on a mix of surgery, chemo, and radiation, but immunotherapy harnesses a patient's own immune system to attack cancer cells. Administering a dual immunotherapy regimen first helps shrink the tumor, making surgical removal easier and boosting survival rates. Early findings show that by the time patients head to the operating room, their tumors are often smaller and more manageable. This approach could reshape how we treat not just head and neck cancers, but potentially other types as well. Though more studies are needed, the initial data is promising, and it might herald a future where cancer therapy becomes increasingly personalized. For patients and families coping with a cancer diagnosis, developments like this offer renewed optimism. In the leukemia field, machine learning is taking center stage by swiftly detecting gene mutations from cell images. Doctors have always known that specific genetic changes can shape how a patient responds to treatment. But spotting these mutations isn't simple. That's where AI steps in, scanning thousands of cellular images in a fraction of the time it would take a human. By highlighting subtle variations that might otherwise go unnoticed, these algorithms give clinicians a more accurate picture of each patient's cancer. Early detection of such mutations means doctors can start more effective therapies sooner, potentially improving survival rates. Though it can't replace skilled pathologists, machine learning serves as a powerful tool to complement human expertise. It's another example of technology's growing role in healthcare, helping pinpoint issues faster and tailoring solutions more precisely to individual needs. HIV research is also seeing a game-changer, a new way to spot dormant cells that silently harbor the virus. These hidden reservoirs evade conventional treatments, lurking in tissues and ready to resurface if medication stops. By pinpointing the unique markers of these sleeper cells, scientists can explore therapies to eliminate or neutralize them completely. It's a breakthrough that brings us closer to a functional cure, where HIV might never reactivate. Imagine the difference for those on lifelong antiretroviral drugs, who worry about viral rebound if they miss even a dose. The potential to truly shut down these hidden pockets could drastically reshape how we treat HIV. While it's still early days, this discovery represents a huge leap forward in understanding the virus. If further studies confirm its effectiveness, it may one day transform the way we fight HIV globally. Turning to Alzheimer's, scientists are exploring a concept called bioenergetic age, how efficiently cells produce energy, and linking it to the risk of dementia. A lower bioenergetic age suggests your cells function more like those of a younger person, potentially safeguarding the brain from degenerative changes. Early studies hint that diet, exercise, and stress management might keep cells operating in peak form, but there's still much to unravel about the exact mechanisms. If these findings hold, we may see targeted approaches that aim to keep cellular energy levels high, as a preventive measure against cognitive decline. It's an optimistic angle on a condition that often feels overwhelming. By refocusing on the body's energy production, we might discover new strategies to delay or even prevent the onset of Alzheimer's, giving hope to patients and caregivers alike. Parkinson's disease has also seen a massive breakthrough, as scientists finally cracked a decades-long riddle: how certain proteins misfold and clump together in the brain. These clusters, known as Lewy bodies, have been at the heart of Parkinson's research for ages, yet the process behind their formation remained elusive. Now that experts understand the misfolding steps more clearly, they can develop targeted treatments to halt or slow this chain reaction before it damages nerve cells. Imagine intervening early enough that symptoms never fully take hold or progress much more slowly. While it'll still take time to translate these findings into everyday treatments, it's a milestone that energizes the Parkinson's community. After years of frustration, researchers are finally seeing a roadmap for tackling the disease at its source. This offers real hope for patients looking to preserve mobility and quality of life. Finally, let's talk about something often overlooked in lung health: diet. While smoking remains the top risk factor for lung cancer, recent research points to the potential role of what we eat, especially in non-smokers. Scientists suspect diets heavy in processed foods may fuel inflammation, creating an environment where cancer cells can take root more easily. On the flip side, nutrient-rich foods, like fruits, vegetables, and whole grains, may help reduce oxidative stress and support healthier lung tissue. This isn't a free pass to ignore other factors, but it adds another layer to how we can protect ourselves. If anything, it reminds us that our health is a tapestry of different habits, all interconnected. By paying attention to our plates, while also avoiding toxins, we might guard our lungs more effectively and potentially cut down on overall cancer risk. And that wraps up our Health News Roundup. Thanks for joining me today. If you found this information valuable, please hit that like button and subscribe for more health updates. Until next time, stay curious and take good care of yourself.